hello. Come on into All Things AuD. I'm Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
And I'm Rebecca Crowder, the audiology resident here.
So we have a slightly different look, just we're playing around with some different features here on StreamYard, but also trying to capture your attention. I am going to put up the YouTube so that way Dr. Galloway or Rebecca can kind of talk a little bit about this real quick while I share this show out.
Yes, so if you go to YouTube and you put in our business name, you can subscribe and you can see all of our old episodes here. If there's a week that we don't have an episode or over the holidays or whatever, this is an easy way to send it to somebody that doesn't have social media. So there's cute thumbnail images and you can kind of see what all of the topics are. So this is just another way to watch our show. And then, of course, you can subscribe. So that way you'll know when we have new episodes.
Yeah. All right. So just kind of showing the playlist real quick. And we are going to make sure, hold on, I'm just making sure we get everything all shared out. And okay. All right. So I'm going to take this down here. We're going to talk a little bit more about our topic today. Okay. So today, we looked up different awareness months, and we thought it was kind of interesting to see that there are a lot of different awareness months. Obviously, October is Audiology Awareness Month, but as people are sharing it, I want to make sure that we do something slightly different. So October is Audiology Awareness Month. So in case you want to take a look at some facts and some good resources, you can look at the Academy of Audiology. We saw that they are doing some great posts. We had shared them on our story as well today. So if you are looking for some great audiology facts for Audiology Awareness Month, please look at the Academy of Audiology or your favorite audiologist that you know, their business, or one of our fun colleagues that are active on social media. They are also sharing audiology for Audiology Awareness Month. October is also Protect Your Hearing Month. So if, again, you want to learn a little bit more about protecting your hearing, the Hearing Health Foundation is doing a lot of different posts. Again, check our story out because we've shared some of the things that they're doing. We just don't want to have to reiterate. And we're going to take a little bit different spin on the awareness month for you guys today. But we are going to also make sure that it is relatable to audiology. But if you're looking for Protect Your Hearing Month, check out the Hearing Health Foundation. They are doing some great posts and some great awareness posts. So please check into that. So look at the Academy of Audiology for Audiology Awareness Month, and then also the Hearing Health Foundation for Protect Your Hearing Month. Okay, but with that, great audiologists are out there. Great foundations and organizations are sharing audiology facts for the month of October. So our spin is going to be a little bit different. So I'm going to start off with the month that, or the, what we want to talk about here, which is Breast Cancer Awareness Month. And so here's a couple of different facts that over 4 million women in the U.S. are living with a history of breast cancer. Risk factors include age, especially after menopause, family history, race, which there is a higher prevalence in African Americans versus Caucasians, obesity, alcohol consumption. So those are some different risks that are for breast cancer. And then the one that I really like to share a lot is breast cancer can also occur in men. Even though it's rare, I just wanted to state that as a fact because I think that's really important as well. Why is knowing about breast cancer important to audiology is because there are certain chemotherapy drugs that are out there like cisplatin and carboplatin that can cause hearing loss, and those are called ototoxic drugs, and they can damage the inner ear. And so if you are going through chemotherapy drugs, please ask your doctor if there are things that you are on that could be ototoxic. Now, we're not saying don't actually take these drugs or use them in your chemotherapy, but here's how we can help. You can always come in and we can kind of monitor where you are with these ototoxic drugs, which means we can get a good baseline hearing test, but then we can also monitor it as you're going through chemotherapy as well, so we can see if there's any changes. Sometimes it even incorporates a little bit different way of how we test you. So we have a high frequency headset. We might want to start watching more of your high frequencies, your ultra high frequencies, I should say. But I think it's important to kind of just monitor that. And then once you're done with chemotherapy, we can kind of take a look at whether or not we need to adjust your hearing aids, or maybe now it's time for hearing aids after chemotherapy. Also, we're looking at hormonal changes. So any alterations to your estrogen levels may contribute to changes in your hearing as well. So maybe you're not on chemotherapy drugs, but any type of hormonal changes that we want to make sure that we can document as well. So if you're going through that, come on in. Let's do a baseline hearing test. Let's watch you as you kind of go through this. Age, obviously, age-related hearing loss, but age-related hearing decline can be worsened by cancer treatments. And so as you're going through different chemotherapy or different treatments, make sure that we are checking along with what we call presbycusis or age-related hearing loss, because it can worsen with any kind of cancer treatment. And then also drug interactions. We've talked about ototoxic drugs, but other medications may cause hearing loss or may make noise-induced hearing loss a little bit. I would say that it can affect it so your hearing loss can go faster if you're on certain drugs that you need for breast cancer treatments. So what can you do? Number one, you can ask your doctor if regular hearing tests are recommended. They'll know if you're on any ototoxic drugs. But anything really related to hearing damage, we want to make sure that we can kind of take a look at that. So I'm going to pass it on to Dr. Galloway. And meanwhile, we'll make sure that we put some good resources in our comments that you can click on. They're hyperlinks. So that way you can kind of learn a little bit more. So October is Breast Cancer Awareness Month. We've talked a little bit more about that related to hearing loss. And now Dr. Galloway is going to take it away with the next October month.
Yes. So October is also ADHD Awareness Month. And so that does have some ties to audiology. Approximately 5% of the US population has ADHD. And I think that figure is rising, probably due to better identification than we had in the past. It persists throughout a person's lifetime. So it kind of was an old thought that kids grew out of it. We know now that it's a neurobehavioral condition and there's no cure. And so the majority of people do not grow out of it. Approximately 2/3 or more of children with ADHD continue to have symptoms and challenges in adulthood that require treatment. It does occur in both men and women. Typically, boys were more diagnosed than girls because girls present a little bit differently. And so it is pretty equal, although in the past there were kind of more boys diagnosed than girls. And why it's important to audiology is auditory attention is a really big piece of auditory processing. We perform auditory processing disorder evaluations in our office. And a lot of times we will have people come in and, they're kind of telling us about their history and everything. And a lot of times, even when we're testing them, we can tell it's kind of the attention piece. Like we're having trouble keeping our attention to the auditory information that we need to be repeating for the test. So sometimes people come to us for a possible APD diagnosis and leave thinking, okay, well, that's, I may also have that going on, but I might need to go check and see about possible ADHD. I do have ADHD, so I'm kind of like a warrior to help other people get diagnosed. And I think maybe I'm a little more in tune with some people's symptoms and able to kind of identify somebody that might also have that condition. And so we had a patient this week that's kind of an interesting story, and it's a pediatric patient. She came to us for a hearing test. And the hearing test was actually pretty hard to get because at first we thought she had some hearing loss. It was really a lot of attention difficulties in the booth, and pressing the button whenever you hear beeps is not very exciting, especially if you're a small child. So we actually did the hearing test over 2 visits, was able to get that to normal hearing. She is diagnosed with ADHD. And when I put her in the booth to do the APD test, I knew it was not going to go well because she could not attend to what, the task at hand. She was very busy and like looking around and, kind of like rubbing on her clothing. And so I ended up getting a fidget spinner out. It's like this little robot arm that has two different colors of plastic pieces. And so I said, okay, I'm going to give you this toy and you can play with it, but you have to listen to the test. You have to repeat, back what I'm asking you to do. And it was totally different. She was very busy with her toy and she repeated everything back. She attended to the test. She actually took the toy entirely apart and it was white and black. And she put all the black pieces in one pile on one leg and all the white pieces in another pile on another leg, and then reconstructed the toy in a different pattern. It was intermixed white and black. She did the top half of the toy black and the bottom half white without asking any questions, all while still attending to the test. And she does have auditory processing disorder, but it was amazing for me to just see that difference of her sitting in the booth. And thinking about the experience when I grew up as a kid, fidget spinners were not acceptable in the classroom. You were not allowed to have like something to play with, but now that is more acceptable. And I actually wrote it in her report that I think that's really essential to her classroom learning, is being able to do something else at the same time so that she can actually attend better. And I think that's kind of where it comes really into audiology, is sometimes we see patients and it's like, how much of this is attention versus actual, auditory processing. And so it's kind of near and dear to my heart, but there's been more studies about it. And in 2017, there was a study where children with ADHD scored lower on APD tests. There's actually an older study where a patient with a patient with ADHD, if they were medicated for their ADHD, would not score with auditory processing disorder. But if they were unmedicated, then they would score with it. And that makes a lot of sense because you can't hold that attention in the booth. And the SSW, which is one of the test batteries that we use for APD, they actually talk about that in the manual, which I thought was very interesting. A lot of children are not medicated. This child that I'm talking about is not medicated, but we know that she has ADHD. And so just doing these things to kind of help support her. We actually ended up fitting her with some hearing aids to help simplify her environment, and she's getting rave reviews in the classroom. So this is kind of an ADHD, APD combo story, but sometimes you just have to look at the person and see what can we do functionally, what could help you with your life. So what can an audiologist do to help? An audiologist can perform APD testing. So if we have a patient come in, they've got some complaints of difficulty processing or, mishearing things, we oftentimes will have them come back and do an APD test. And if that is normal, or even if it's not normal, it kind of opens the door to talk about other things they might be experiencing or their history. I might feel a little bit more comfortable doing that just because I can relate a little bit more to what people are dealing with. But I think we can also be that conduit to encourage someone to go see a neuropsychologist and have testing, just to learn more about themselves. It doesn't mean you have to take medicine or do anything like that, but audiologists can certainly help and be supportive. And I've had some really positive comments from patients when they left their APD eval that they felt like they got more out of it than just being tested for APD, because I was able to encourage them to go see like a neuropsychologist or somebody that can, help them with that ADHD diagnosis too.
Nice. Yeah, I thought it was really creative of you to do that, and that you were able to get some good results from that. So that was awesome.
Well, and informed teachers, I could see how, this kid is disruptive or they have behavioral problems. They can't play with a toy during class. I could see, with discipline and how those things could come into play. But for certain kids, it's like the difference between learning and not learning, And so I think being able to give those non-audiology recommendations too is important, because other, teachers and caregivers just might not have that bit of information.
Yeah. Awesome.
Yeah.
All right. And then we're going to head over to Rebecca.
Yeah. So I was investigating of course, October is Awareness Month for many things, and I was tasked with Domestic Violence Awareness Month, which I didn't know much about. And its first observance was in 1987, and a couple of years later, Congress actually officially designated October as the National Observance Month. So it's really a time for communities to kind of raise awareness, support the survivors, and really commit to prevention. And just some facts about domestic violence that occurs: about over 10 million Americans are victimized every year. 1 in 15 children are exposed yearly, and about 15.5 million live in homes with partner violence. A lifetime of prevalence occurs in about 35% of women and about 28% of men. So it's not exclusive to one gender or sex. And a severe physical violence by an intimate partner occurs in about 1 in every 4 women, about 1 in every 7 men. And it's obviously a very serious issue, but I wanted to kind of tailor the awareness a little bit more to how hearing difficulties might play a role in that. So I found a few studies that linked severe physical violence to hearing issues. One of them was done in 2009. It was a study of 242 women who experienced what they're calling intimate partner violence, IPV. It's also a synonym for domestic violence. Of those 242 women, 24% had head injuries, and 1/3 of that 24% ended up having symptoms of reduced hearing. So we know with damage to the skull and the head where your inner ear sits, there's certainly that risk for damage to that structure, resulting in hearing loss. There was a study done globally in 2025 that showed that traumatic injuries also caused TM perforations. So the tympanic membrane was perforated as a result of trauma as well. And then a more interesting one was done in 2011. It was a survey that examined domestic violence and perceived social support in a clinical sample of deaf and hard of hearing women. So ideally, women who have already experienced some hearing loss or have been congenitally deaf. And they report about 56% of those women had a history of physical violence from a partner, and 71% of them reported psychological abuse. So we know that physical violence can cause hearing loss, but already having a hearing loss or a hearing difficulty may put you at risk for enduring violence as well. So just some things to be aware of and how domestic violence can affect our hearing. But ultimately, what can we do about it? That's kind of what it comes down to. The biggest thing is kind of as an individual going out and learning warning signs. If you happen to have a friend, a family member, coworker, just noticing that they might be isolating themselves, that they might talk about how their partner really controls the finances, or even maybe talks about threats and escalation. Some things to be aware of, kind of that old adage of see something, say something. And then biggest thing for us, I think, is being supportive of survivors. And if they share their story, believing them and kind of referring to domestic resources that we have. I know we posted some links in the comments today, so those are there for you to check out as well. And as audiologist providers, I think we had a situation earlier this year that we had someone come in and they had visible bruising on their body. And so our provider took the time to create a safe space and a safe environment and just ask that individual if they were safe, and not necessarily, get on the horn and call a bunch of things, but just by providing that safe space, that individual was expressed gratitude and concern. They were safe, but they were thankful that they had experienced abuse in the past, and they were thankful they had a provider that cared enough to mention something. So it's I think as providers, I think we can kind of skirt that uncomfortable line and do our patients a service by just merely asking them how things are going and making sure that we can get them the resources that they need. The other thing that's out there too, I recently looked at the Hearing Aid Project, and they just posted a story about how they were able to help an abuse survivor who has hearing loss as a result of her abuse. They were able to help her with getting hearing aids. So that's an option. You can certainly donate devices, but you can also donate directly to the Hearing Aid Project as well. And there's many other companies. I think in preparation, Natalie was sharing that she has an anecdotal story of someone that was able to get help. I don't know if she wants to jump in and share with that.
Yeah, let me see if I can grab her picture here. So I was doing this here so that I could grab her picture. This was a friend of mine, and she's a musician, and she was on The Voice. And we were talking one day, and she was telling me about how she didn't hear very well, and she just thought it was her, and didn't even think about it. Like she created a nonprofit surrounding domestic violence to protect survivors, and ended up being that she came to Colorado. And I said, you know what? Let me just test your hearing. Let me just see what's going on. And so she was here to actually look at different safe houses. And so I got her into the clinic, and I was able to test her. And sure enough, I found a little bit of a hearing loss. And so I said, you know what? Let me reach out to one of our manufacturers and see if I can actually fit you with hearing aids, and let's just see how you do. And so she was able to be fit, and I had somebody follow up with her when she returned back to her wherever, the state that she lives in. And she openly shared this on her page, but she said, like, I had no idea that I had a hearing loss from all of those years of being hit in the head, and how I was struggling. And so, wearing her hearing aids now, she's super happy. So it makes us really think about whether or not we're looking at all of our patients in a certain way. Like here at Audiology Center of Northern Colorado, we do see a lot of head injury patients, not necessarily from domestic violence, but from accidents, sports injuries, things like that. But I had a friend the whole time that did have some hearing loss, and had no idea because it was minimal, but just enough, right, where she was struggling in crowded situations and being in the entertainment field and everything, just having difficulty with even her music. And so once she started to use hearing aids, she did a lot better, and she was super thankful because she had no idea what hearing aids could do. And so I just wanted to kind of share that, because it really takes a look at, whether or not we as audiologists, like, we can focus on Audiology Awareness Month, but it's also good to focus on some other things, and how does it relate to audiology, and are there things that we can help spread, even awareness about, right? Like, it can be facts, but it can also be like, hey, an audiologist can still be part of this, and what we can be looking for. So we just thought that it would be interesting to share some different awareness months in the month of October, to be able to kind of really show what an audiologist can do. And maybe we might be, the first line of defense when you come in to just have something as simple as a hearing test. So if you guys have any other questions, anything else that we want to add before we end the show today?
I don't think so. Yeah.
Okay, well, awesome. So if you guys have any other questions, we have all the resources linked in the comments, both on Facebook and YouTube. Also LinkedIn, I should say LinkedIn. Again, I think that our colleagues and our organizations are doing a great job spreading audiology awareness for the month of October. But if you have any other questions or anything else regarding breast cancer, ADHD, or domestic violence, and how an audiologist can help out in those areas, please do not hesitate to reach out to us. And we hopefully will be back next week with a new episode. But until then, we'll see you. We'll see you then.
Bye.
All right.
Thank you.